everyone. Welcome and thanks for joining us. My name is Christabel Darthy. I'm co-convener of the NT branch of the Australian Evaluation Society, along with Dr. Alison Reedy. So I'd like to start today by acknowledging that I'm hosting this call from Larrakia country. I acknowledge the Larrakia people as the traditional owners of the Darwin region. And I'd also like to acknowledge the traditional owners of the many countries that people are calling from today.
Yeah, we're good.
And pay my respects to elders past, present, and emerging. So this session will be recorded and added to the AES YouTube channel. So unless you're presenting, you might like to be on mute with your video off. Please put any questions in the chat and I'll facilitate questions at the end, or I'll raise them during the presentation. So today we're talking about using Australian Early Development Census data to close the gap in early childhood development. And we have two presenters, Karen Cieri from the Northern Territory Government Department of Education and Anita Graham from the Aboriginal Medical Services Alliance Northern Territory, or AMSANT. Many thanks, Karen and Anita. I'll hand it over to you.
Thank you so much, Christabel, and thank you, Anita, for collaborating on this presentation with me. And thank you for that acknowledgement of country. And we, Anita and I, are here on Larrakia country, and so I pay my respects there too. We are talking about the Australian Early Development Census. There's the picture, in case you've never seen it before. This presentation's going to be it's almost like, we're going to look out across the landscape of all the things and all the places that we could go. And maybe that's enough of a sense of direction for some of you to go and, check some things out. But more, it might tell you what sorts of things we could talk about or collaborate on later. So it's, I guess, a bit of an orientation in that regard. We're going to structure this presentation around the framework for the governance of Indigenous data, which is what the Australian Public Service use. I'm just trying to move this video around so it's not in my way. For governing, I suppose, their data. It's connected to closing the gap. And you'll see it's got this line of circles down the side. That's actually a cycle. It's a data governance cycle. And these are the 4 guidelines. And you'll see how, those guidelines, anyway, for my work have been really useful to organise my thinking and my approach, and thinking about how those guidelines work across the life cycle, I suppose, of the data. So here's those guidelines as an agenda. We're first of all going to talk about partnering with Aboriginal people and what that means for the Australian Early Development Census in the Northern Territory. And issues around building an inclusive data system, including what is child development and what is the AEDC for. Then we're going to talk about the data asset itself and give you a bit of a sense there. And I think that will help, those of you who use data to see whether this has got things in it for you and where to find it. And then we're going to talk about some data related capabilities, some ways that we want to support people to use data, and Anita's really, going to share some of the AMSANT story and way of working around that piece. So, really conscious I'm a bit of racing a little bit. So that's the other thing too is, putting questions in the chat. Christabel's going to keep an eye on that. I'm really, hoping that your questions and Christabel and Anita making connections will help keep it relevant to you, the people in the room. So partnering with Aboriginal people, I guess the Australian Early Development Census has a bit of a long history. Like was developed or started in 2009 was the first collection. But in recent years, it's become a measure for closing the gap target 4, which is that 55% of children will be, Aboriginal children will be on track on all 5 domains. And we'll talk a little bit more about that later. I've really connected my work to the 10-year generational strategy, and I'll explore or show why that's a really great fit for the Australian Early Development Census that is so holistic as a measure, but also in terms of what is required, I suppose, to change those outcomes. And my role is in the Northern Territory Department of Education and Training. So that's the education strategies most closely governing my work. And I suppose 2 things to say about that. One is that across the country, there's a person like me in every state and territory. We're called a state and territory coordinator for the AEDC, and we're Australian government funded. And some of the coordinators are in departments of education, but some of them are in like your community services or like your child and families departments. But in the Northern Territory, it's education. And I think that so far that has meant that our approach has been very much focused on schools. And I suppose what we're doing now, and I've just been in this role the beginning of last year, and so with me starting in the role, we've sort of tried to change a bit of a gear really, and have more of an ecological perspective and a much more of a pre-birth to 5 focus than a schools focus, which is why the generational strategy as well. So one of the, if we're partnering with Aboriginal people, we need to talk about ways of working together. Segue to Anita, who's going to tell a bit of a story from AmSant and her perspective.
Hi everyone, thanks Karen and Christabel. So my name's Anita Graham. I'm a Narungga woman. My family's from the Yorke Peninsula in South Australia, and I live and work on Larrakia land in Darwin. I'd also like to acknowledge the Larrakia people as the traditional owners of this place. I'd like to acknowledge the elders past, present and emerging and their connection to the lands, the seas and the waterways. I'd also like to pay my respects to any fellow Aboriginal people joining us today. So we've all heard the phrase, nothing about us without us. Now, why do we say that? Well, for context, Aboriginal people are likely the most studied population group on the planet. Most of us know that it's imperative to ask for involvement from Aboriginal people and communities when we're researching and undertaking work that affects them. This consideration should also extend to all stages of using their data in line with closing the gap priority reforms. The data is a primary catalyst for change, and so consulting on the collection, analysis and dissemination of this information is really crucial. Closing the gap reform targets ask us to increase the number of regional data projects to support Aboriginal and Torres Strait Islander communities to make decisions on how to close the gap and about their own development. So by promoting community engagement in data, we're going to end up with better outcomes and some really valuable insight and creativity about how we actually achieve those desired outcomes within our communities. And I'm really glad to see that Aboriginal consultation and data sovereignty is something that Karen and the Early Development Census team take extremely seriously and are actively looking at ways to implement. We've recently enjoyed a very mutually beneficial relationship between the NT Education Department and the Aboriginal Community Controlled Health Sector, which has enabled us to continue developing the AEDC's approach for improvements in usability of the data, in building ongoing relationships with Aboriginal organisations, and in planning how to implement the feedback that's received. I feel that this has been a really great opportunity and a great example of what we can achieve when we're working together. And this is because Karen's team recognises that when using a population data set, it's really essential to keep in mind the power imbalance at play here. So it's always just good practice to apply critical theory into our thinking when we're discussing Aboriginal data to provide that necessary context of post-colonialism. And by this, I mean that we have a dominant population studying another more marginalised population. And so we just need to be aware of that imbalance. We need to recognise and acknowledge it. And then that understanding just needs to form a part of our overall systems and processes. I have seen that the AEDC team are committed to ensuring this is done sensitively and with the utmost respect. So yes, like I said, just be a matter of being mindful of the way that we're using the information, of the way that we're communicating about it, that we're ensuring Aboriginal people and community have a really good level of oversight and involvement in governance when using this information, and that the community has many opportunities, or as many opportunities as possible, to build their own capacity and comfortability when working with data, because this data is theirs. Essentially, it belongs to these communities. It's their story of recovery. And by committing to using the data in a respectful way and by consistently inviting Aboriginal people to sit at the table, this is how we can build trust. As I said before, when we're looking at another population's data about their life and their children, we need to make sure that we're not placing our own cultural and moral judgments on that information. I do believe it's really important to view all of the data presented with a degree of cultural relativism. So we just need to recognise that there's no superior way of knowing, being and doing. So just keeping in mind that data doesn't tell us everything too. So the data doesn't tell us how much Aboriginal people love their children. It does tell us a lot though about the effects of socioeconomic disadvantage, but also where our strengths are too. So to summarise this point, I just wanted to highlight that it's just good practice to recognise the lens that we're viewing the data from. For instance, I am an Aboriginal woman, but I didn't grow up on community. I grew up in the system actually, and so I lost some connection to culture. And therefore, I'm by no means speaking to you with any kind of cultural authority today or assuming that I would understand what it's like to be affected by factors such as remoteness, because that's not my role. But what I can share with you today is what I've learned and observed through my own experiences as an Aboriginal person working within the health sector, and what I've learned through listening to what communities and services are telling us. Also, lessons that can be learned through using and applying the principles of continuous quality improvement and clinical governance generally. So for those of you that haven't used the, or that have used, sorry, the AEDC data before, you'll know that data can be presented in a way that highlights areas where kids are on track. The data can also be viewed to demonstrate where kids are developmentally vulnerable. And a strengths-based approach is amazing and quite often the most appropriate basis for a lot of the work that we do. And it's great to celebrate those wins and to increase confidence. It is my own belief, though, that we can't fix what we're not looking at. So we just need to see the whole picture, the areas where we're doing really well and those areas that we're not doing so well. And so continuous quality improvement is a journey, and it looks different to different groups of people. But at the start of that journey is honesty. It's just simply taking a snapshot of where we're at, deciding where we'd like to be and putting steps into place to ensure that we can get there. So that means a culture of no blame, no shame. Everyone's on a different journey and at different points in that journey. We recognise, though, that there's been incidents in the past where information has been used against Aboriginal populations and trust was breached, but it's time to start regaining that trust through better consultation and engagement and building data capacity in community too. Information sharing is key here as well to get a broader picture and understanding of what's going on and how these social determinants are interacting with each other. So we need to make it easier to share data and increase visibility while also fostering that really safe culture of continuous learning. You know, and we can't really truly say that we're operating within the context of socio-ecological models to address these social determinants of health unless we stop working in silos and increase efforts to cross the divides and increase collaboration across networks and sectors. We just need to recognise as well that we're all working towards the same goal and everyone's invested in what's good for our kids. So performance tracking and the understanding and concept of doing well differs again between populations, and that's another issue. However, I think there are things that we all agree upon, outcomes we'd like to see, and aspirations for the future. So this is what I believe will enable us to move forward together, to freely share that information with each other in a respectful and understanding way, to regain that trust and to find more ways to build beneficial relationships. I'll hand it back to Karen. Thank you.
Thanks, Anita. And so with that, I guess, culture and relationship in mind, that's the way we want to go through together. And the generational strategy, I just want to kind of plug that particularly for Northern Territory government people, that if you've read a lot of strategies before, this one clearly has a different voice. So it was developed with Aboriginal people, and that's clear. And so a lot of the sentiments that Anita's mentioned are sort of echoed there. So I really recommend going and engaging with that strategy and as a resource for your work, because we're all in it. You know, it's about all of the areas of service and need that children and families have, and we're all in the concentric circles of our whole ecosystem. It also talks about these 4 pathways of change, which are, I guess, these kinds of sort of ways of working, and that's where the AEDC and data sovereignty, I think, really can support those 4 ways of working across the whole strategy. For my work, my most direct connection, I suppose, to community and to Aboriginal people is through the child and family centres that the Department of Education run, and also that the Northern Territory Children and Families also support Aboriginal community controlled child and family centres. So they are my first, I guess, network of working with them to use the data, and so I'll unpack that a little bit more in a minute. But also through my, new and productive relationship with Anita recently, been able to make some really strong connections into the Aboriginal community controlled health sector. And also in my team, we've got a project with what they call triple CFRs, which are really Aboriginal controlled long daycare centres that are funded in a particular way. So we'll also have the opportunity to support them. So I guess there's lots of opportunities to work really closely with Aboriginal people with the data. And in terms of this section of the presentation about partnership, I just want to shout out to the cultural consultants, the Aboriginal people who support teachers in all the schools to help collect the data when there's Aboriginal children in the school. And, over this collection period, we want to have a relationship with those people as, assistants, but also as advocates for the data. So building an inclusive data system, starting with ideas about conceptualising child development. And so if you remember that data cycle, it starts with the concept anyway. And I suppose for the AEDC, in a way, that ship sailed, in 2009. However, when we are talking about the data, particularly with Aboriginal people, my practice, it's kind of early days for me, but I want to come with or from a place of understanding the perspectives on child development of the communities that I'm working with. So, and there's plenty of communities in the Northern Territory that have done a lot of work documenting and articulating their perspectives on child development journeys. And so starting there as a point of shared understanding, to then explore what might the AEDC might have similar and what it might have different. There's a link there to the validation study from back in the day if anybody's interested. Some of these conversations about these, I guess, two-way perspectives on child development have suggested that maybe the AEDC could be framed more as an understanding of school readiness. So I guess with the validation study where it was, Aboriginal people were consulted about the questions and, the validation study would say that the questions are satisfactory, and maybe that might be the case, but maybe it's more about what's not measured is more the issue. So that's the invisibility, I suppose, of other skills that children might have. And that's something to bear in mind. So whatever, if you're from an education sector or a school or long daycare, we have put in quite a bit of work of mapping the assessments. So if you want to know what's the same or different, we've got a link to eLearn there that you can create an account for. Same with developmental screening. So the AEDC is not a diagnosis or a developmental screen, but some of the questions are the same. So we've mapped those. And the AEDC is kind of it's a population measure in a sense like a social economic status indicator. So it gives a bit of a global picture, I suppose, of how communities are doing. And then there's another perspective that's being developed is the Australian preschool outcomes measure. And I just mentioned that because some people in the audience might have heard about that and might be going, what's the difference? And the difference is that it's early days for the preschool outcomes measure. They're different kids for a start. Preschool versus transition is the Australian Early Development Census. And I'm sure that the preschool outcomes measure will be nothing like the holistic measure that the AEDC is. It'll be just about literacy and numeracy. So this is the holistic picture of the Australian Early Development Census. I'll unpack this a little bit more, but you can see there's 5 domains, excuse me, including the physical health and well-being, social and emotional. Where we talk about cognitive or language and cognitive skills, school-based, that's really early literacy and numeracy, and communication skills is really oral language in both English and first language. So what's the AEDC for? Like really, it's been most used, I think, by researchers into child development and being able to look at longitudinal linked data. Planning and evaluation, we've mentioned closing the gap, and that it's, it's a population measure that gives a picture of relative strengths and needs or complexity in different places. There's also probably some potential for it to be used in the Northern Territory to identify some additional unmet additional needs, because there's some questions that I think could be really useful for putting that picture. And there's a bit of a policy placemat if you want the latest summary of what we've learned from the AEDC. But I think something to sort of emphasise is that it's not about individual children or individual schools. It's not about assessments or diagnoses. It's actually a teacher survey of what they know about the children. So another perspective on whether this data is useful for you as an evaluator is who's in the data. So the data is always reported longitudinally or as trends. There's the first collection in 2009, so those children are turning 20, and every other child in the data is still kind of school age, and our responsibility as educators in any case. This year was a data collection year. It's only done every 3 years, so for children in transition. So it's intended to be a picture of what children come to school with. So not what they learn at school. It's kind of meant to be the baseline, if you like, of education. And the children who were assessed in the last collection, assessed isn't the right word, surveyed in the last collection, did NAPLAN this year. And so then looking forward, the next collection in 27, those children are currently 2. And the children who we will measure to close the gap in 2030 are being born now until the middle of next year. So we've already left the starting blocks.
Karen, there's a good question in the chat, which I might just bring up now.
Perfect.
Because it's relevant. You mentioned it's a teacher survey. So Bridget has asked if there's any work exploring the reliability of the teacher's response on the children speaking and listening in their home language, or how confident the cultural consultants feel to answer that question. So that seems really relevant now as we sort of would love you to respond to that one.
I think there is research about the validity of things, and there's also questions that directly ask teachers about their confidence to be able to answer those questions. So they can say, it's not forcing them to answer, and they can say, actually, I don't know. And that's one of the reasons why they have a cultural consultant involved, is to be able to, provide another perspective on, or confirm that actually, yes, adults can understand this child in their first language. But the idea is that, and why it's not an assessment, is that the survey is supposed to be done by a teacher who knows the child well. And there's criteria around whether you've known the child enough. They can't have been enrolled in, 2 weeks ago. So I guess there's those qualifications about people's confidence, and that's what the cultural consultant is also, to add context or a view about what children can do. Did I answer all the parts of that question?
I think so. Yeah, it was those 2 bits around the teacher's response and the cultural consultant. So it sounds like there's certainly not an assumption that this is.
No. And, I guess maybe as much as this data says something about children, maybe it also says something about teachers, or schools. So there's also that lens on it.
Yeah, which is where Anita's points are really important.
Exactly.
About how we interpret it. Yeah. Lovely, thank you.
Okay. All right. So who's the Australian Early Development Census for? And my answer to that is, whose job is child development? And it's really like all of us. This is the a racy nest that's been interpreted in many ways, particularly in the Northern Territory from Aboriginal perspectives. But really, if your work is in any of these areas, and in many of your different hats in the concentric circles, this is data for you. I'm not going to read this out, but this is the guidelines for data sovereignty, and this is my work. In a way, it's my job description. No, these are like my tasks or projects, and I've just sort of thought about how they kind of, for me, map to the parts of the data cycle as well, and how different things that I can do in support of, or ways of working, or rather this went wrong, that support the data sovereignty guidelines. So for example, my job is to support people to access, understand and use the Australian Early Development Census data. Can I do that in a way? I can do that, and I want to do that. If you look down in data related capabilities, obviously presenting data in meaningful ways, but also can I do that in a way that might convey some transferable skills? So I can be sort of very intentional about that. And just also echoing, Anita's sentiments earlier about, community-led sense-making and advocacy, and unpacking the data in ways that tell more stories or explore stories behind the data, or really being curious rather than declarative. And the other thing too is using those conversations to identify what other data might be helpful to add context or depth or validate or support those stories. So really wanting to connect with other data assets. So just now a bit of a time check. I think we're doing okay. Just really quickly about the AEDC itself. I'm going to offer a proper, in-depth workshop when the new data is available next year. So it's not till April, but anyway. So we'll go through this in tremendous detail. But anyway, these are the sorts of areas or skills that are in each of the domains. I won't read those out because you can have the slides and revisit this. And some examples of the questions. So, you can see about the social things. Are they able to adjust to changes in routines? Actually, some of the things I should have put in the health domain that might be of interest. This is the domain that is most messy, I think. It's got things that aren't just what you might imagine of, your healthy development. It also includes indicators of poverty or neglect, things like coming to school hungry, or having slept, or being dressed appropriately, which I think is more for a colder place if you've got warm clothes or not. So those are, some other useful indicators, I think. And you can see every single question online there. We've got a link there. So generally the data's reported as children being developmentally on track or at risk or vulnerable. So either that they're doing great, or that they're facing some challenges or significant challenges. And those categories have been developed statistically, so it's been about with normal, bell curves and, standard deviations and that kind of thing. I think that's important to know. And then the closing the gap target is being on track on all 5 domains. And there are also headline indicators of being vulnerable on 1 or more domains or 2 or more domains. And there's some fact sheets there. Some other data or other measures that you can get in, they have a great big community report that Anita will show you where to get, is some transition indicators about whether children are settling in at school or their parents have a relationship with the school and whether they're read to at home. There's lots of categories of early childhood education and care participation before they started school. There's lots of information on special needs and whether children require further assessment and in what. There's also lots of information, background on children's backgrounds and questions about their special skills or talents. There's also lots of great places you can get this data. There's the AEDC website itself that Anita's got some shots of. This is a picture of the Australian Child and Youth Atlas. Amazing. It's very much a heat map, and it's not just AEDC. It layers lots of publicly available, mostly for the Northern Territory, ABS data. And the NT Story of Our Children is a dashboard that you can use to also look at a whole lot of other NT Gov data. Or you can talk to a school and collaborate with them. They have their own school reports, and you can talk to me. There is also a linked data set that Menzies have created, which is lots of NT-Gov, probably Australian government data that's been in a special de-identified process. They're able to find individual people and see and match them across a whole lot of different records. So you can see how much children weighed when they were born and how well they did on the AEDC and whether they went to preschool and what their NAPLAN results were. And so this is the sort of research that can really identify things that matter to children. And so there's some reports there. If you've got ideas for questions or stories that could be investigated, let me know. We can talk about that. Anita.
So, as Karen said, you can access information about the AEDC data and the data itself at the website. Now, this is the home page. So you'll see there's a tab for data, and under that you'll be able to access the Data Explorer, which will enable you to generate your own reports for each of the domains. On the next slide, you'll see that you can, once you filter by geographic location, you can download comparison and trend reports, and that can be grouped into whichever variable you need as well. So for instance, you can see children on track by various context variables or time series data as well. So you can see information at the community level, or you can see national trends across each domain, which you can filter by state as well. And so on the next slide, you'll see that the output looks like this. So when you're comparing across census periods, which is really useful when you're looking to assess which domains to focus on in specific communities or locations. Yeah, it's actually a really great portal for accessing the information that you need. And you've always got the option of contacting Karen or the AEDC team directly if you require anything specific. Certainly express your interest in any upcoming workshops. Yes, there's also some other data products available as well on the website. For instance, you can access data grouped by LGA and other population groupings. The data can also be viewed by remoteness too. And there's a lot of evidence and other resources available in the other tabs there on that second page. And once you've filtered by that location, yeah, you can access some really in-depth and comprehensive school reports. And you can also look at the data or access the data through a map format as well, if that's easier.
Yeah, so there's on that download tab, those reports, the comprehensive reports are by community. The schools have their own report that's for their own enrolments. That's not public data, that's their data that they can collaborate with people on. But otherwise, it's published by children's residential address, just like CEFA. So, data-related capabilities.
All right. Sorry.
We just got a minute. We've got 5 minutes.
Oh, okay, right, okay. I'll be quick. So just quickly, for those of you that aren't familiar with the main CQI tools that we use in NT Aboriginal Health Services, a PDSA is just one example of an improvement cycle, which is essentially just a quick continuous process of ongoing learning and sharing. So in CQI, we ask the following questions before we get started on any improvement. So what's the problem we're trying to address? How will we know that there's an improvement? What KPI or measurement are we going to use to track that progress? And how can we reach our goals? So what's the plan? So for improvements on the ground, we just want these cycles to be easy, quick, and something that anyone can take part in or implement. We usually recommend cycles with one small incremental change at a time, and that ensures that it remains achievable, low risk, and low cost. And we like to say at AMCENT that CQI is everyone's business. So we want everyone to be involved in that process too, from the doctor to the driver to the CEO or whoever it is in your organisation. So if everyone's aware of the CQI initiative that we're focusing on at the time, it'll be much more successful. So this is something that any organisation or service can do. So in an improvement cycle or implementing an intervention or initiative, we usually start at the planning stage, so the green area on the diagram. We need to just be really clear on what our objectives are, what we think will happen, and how we're going to get this done. Then we move to the doing stage, so carrying out our plan, documenting our observations and collecting the data. Then once the doing is done, we're onto the study phase, where we're looking at all of our outcome data and we do our analysis. And then the final stage before repeating another cycle is deciding what to do with that information and the outcomes that we found. And so this is where we're evaluating the work that we've done and whether we adopt new measures or implement something else. So for example, I might use my community's data to begin a cycle of improvement if I can see that we could improve something that we're doing. Yeah, I think we're at the next slide now. So we just spoke about PDSA, but I'd like to focus now on the outcome data that we receive when we run through an improvement cycle. So there's a lot of good outcome data out there to provide a broader picture of where we're at with child development. So we have the index of disadvantage, we've got the AEDC data, of course, and some communities are also developing their own data dashboards and analyses to understand their own outcomes, which is truly the ideal. Having each service aware of their own progress through live dashboards, ideally, yes. However, this may not be something that's achievable everywhere, and that's totally okay. But if we remember what I was saying before about those outcome indicators that we get as a result of implementing a measure, we can expand on that. So in a moment, Karen will quickly speak about restacking the odds, but I just wanted to highlight that when we're implementing larger scale programs or improvements, something that we should start focusing on is when we're in the doing phase. It's great to measure some lead indicators. So we want to measure aspects of service delivery for the program that we're implementing, particularly for things like availability, quality, and participation. Right.
Yeah. Yeah, and I think that the AEDC can be used as a lead or a lag indicator. So it's a lag indicator for really pre-birth to 5 anything, but it's a lead indicator particularly for, you know, we saw the ages of children in the data. So it's very predictive of lots of outcomes. So it can tell us something about our cohorts going forward and what we need to do. So we're really conscious that there's something missing between the great big outcome and what we need to do to close the gap. Anita. Oh, you're on mute.
Sorry. Yeah, so like I was saying before, so we can see here, we typically only measure everything at the end. And so what we really want to do is start implementing extra measurements when we're actually doing the work. So we want to see that what we're doing is actually is working. So we can measure short-term outcomes, we can measure medium-term outcomes, and then we can look at the end resulting outcomes as well, and then get that whole big picture. And we can actually adjust things as we're going along, just to ensure the success as well of what we're actually delivering. So it's a really, really important part of service delivery, I think, is to measure what we're doing and track that progress.
And Christabel, one more. Oh, this has got too much innovation. So I think that what in our team, what we want, I guess, the AEDC to do for us is, in terms of building data capability, is really use it as an opportunity to support different sectors and different services on that continuous quality improvement journey. And Restacking the Odds is an evidence partner from Murdoch Children's Research Institute that we've just started. And it's basically what I've now know is like supporting other sectors to really do what AMSANT does and has. So if you're interested in working with us to sort of help quality improvement everywhere in the Northern Territory, this is the start of our journey, I suppose. So what next? If you're interested in making meaningful reports, community planning, building data literacy in teams and community, learning how to use those different data platforms, any research and analysis questions, or using data to tell stories, or that continuous quality improvement journey, what did you say? Press 9 now. And there we are. And so these slides can be shared. All right,
Awesome.
time for questions.
Thank you, and well done both of you for keeping to time so nicely. And there was so much in that presentation, so I don't think there's anything we could have left out. There was lots of good context. Now we've got lots of questions in the chat, which is fantastic. I might just start off with a follow-up question that Kat had on Bridget's question. Again, just trying to understand the validity of the data. So Kat said, regardless of the time a teacher has known the child, they often don't speak the child's first language. So how does a teacher assess a child's language and cognitive development without those skills? So really keen for you to reflect.
Some of the questions are about whether the child can speak English. So there's that. But then there are questions like whether the child can be understood by adults in their first language. And I guess one of the things that I've been trying to impress on people is that this isn't a teacher test. It's not the teacher exam on how well I know my child or the children in my class. So have a collaborative approach and find out. You know, you might have questions that you need to ask the family. You know, maybe the cultural consultant, who's probably your assistant teacher, who you work with every day, probably knows the answer to that. So find out. And so I guess that's over the course of this collection. I guess, you know, that's my job, is to support people to understand what quality data collection in the AEDC looks like, and to do that.
Thank you. And then I go to Manjusha's question, and then we've got 2 questions on the linked data. So Manjusha said, what about kids who are not able to go to school? Do you have an estimate of what proportion of kids are probably not included in these stats?
Oh, yeah. So there is, and that's one of our performance measures, is a population number. And, you know, I think in the Northern Territory, that's probably, you know, questions about that accuracy. But anyway, there's population compared to participation in the AEDC is a measure. So there's that analysis that I don't know off the top of my head. And we've just done a collection, so we'll find out. But note to self to have that information on hand. There is, all schools are requested to participate. It includes, you know, like schools of the air and things like that, so, and special schools. But there are schools that, you know, decline to participate, not many, but there is that. And there's parents who elect not to participate as well. So there's definitely a lot of children missing. But the participation rate we had, like the target is 97% of children in the population participating. Yeah.
And then Christine has a question around the linked data. So mentioning Menzies and linked data, I mean AEDC NT data is examined by Menzies under the CIDERP research program, which uses data from SANT data link. Yes, so that's the same one, the Child and Youth Research Development.
Yes, that's the same one. Yeah. And that's really got nothing to do personally with me. They get the data from the data dudes, and that all just happens. Yeah.
And that's a separate thing. And then Marion had a question around the link data, whether it shows out of home care or youth justice connections. My understanding is it does.
Yes, and they've got a report. I'm pretty sure you can just get it off their website, that link there. And if you can't find it, ask for it. They definitely have done that. Yeah.
And then, Anita, we have a question around the Plan, Do, Study, Act. We talked about defining the problem. Peter had a question, whose perspective is the problem defined? So when we're defining that problem, from whose perspective are we using? Which is a good question.
Yeah, great question. I guess it would be for whoever's implementing the plan. So, it should really involve as many people as possible. So making sure that we are engaging community and all of the invested parties into that planning stage. So yeah, I guess it can be from whoever's perspective is starting the cycle off, but yeah, ideally we'd want to see whoever the cycle is affecting, we'd want them to be involved in all stages of that process.
Yeah. And Karen, Emily has a question. Can you share info on what communities have data hubs and who works on that, so that we might be able to get in contact with them? Is that something you have visibility on?
So I'm not sure about who has data hubs. I want to know that if they already exist. My assumption is that they don't exist, and that that's the kind of asset, I suppose, that maybe we can work towards creating. Where I'm starting from is, I've got to, share the data and, talk people through the data and encouraging their questions, and then I guess advocating for who can help us answer those questions. And so it's early days about what that really looks like, but working with Restacking the Odds, who are building dashboards for people, for different organisations. What does that look like? What could that look like in the Northern Territory? Is that organisation by organisation? Are there some sectors like child and family centres who, maybe they could have a similar one, or we could work it out together, something like that. So if there are data hubs, I want to know.
Emily said she was referring to the slide, which I think was the Restacking the Odds.
Yeah.
The last slide referenced data hubs. Yes,
that's right. That's the dream. That's the dream. If you want one, get in touch. Yeah. So Menzies Murdoch is working with organisations to create that for them and support them in a community of practice to do continuous quality improvement.
And then we've got quite a few thank yous. Adam has popped in 9, so I guess he's interested in having a follow-up chat. And quite a few people acknowledging, that the Wellbeing Atlas is a useful data source. 97% is a good target, that we're trying to include as many people as we can. So lots of thank yous, but I think that might be it for the questions.
Yes.
I have one, if I may. Anita, what you were saying at the beginning around that importance of breaking down silos, such a good point, and around information sharing is key, and the importance of building trust. Just wondering if you can point to any examples of what that might look like, or is that something that we're still working towards?
I think it's something we're still working towards, really. Karen and I have been, we've really enjoyed being able to sort of kick this off, like this whole conversation that we're having, and we're just looking at ways that we can bring other organisations and other communities into the conversation as well. So I think it's kind of just getting started. As far as I'm aware, like Karen said, I'm new actually to the territory, so she's introducing me to a lot of people, which I appreciate that. But yeah, I'm really enjoying being able to have these conversations and looking at the different ways that we can implement processes and systems to have those conversations on a regular basis and making sure that it forms a normal part of the framework that we're working within.
Lovely. Thank you. And thank you both so much for your generosity today, the time you've taken to give the presentation, but also your generosity in terms of the follow-ups, sharing the slides, sharing your contact details. I'm sure there will be people from today's presentation reaching out. And I think that's a really great step in beginning to break down those silos. So thank you both so much.
Absolutely.
Thank you so much. Thanks for the opportunity, Christabel, and for holding our hand through the whole time. And I think, are we actually meeting this afternoon? Is that a thing?
That is a thing. Yes.
Okay.
So having an informal AES NT catch up for people who want to join in if you're in Darwin.
Amazing.
Lovely, lovely. Thanks so much, everybody. Oh, lots of thank yous coming through in the chat.
Yeah.
Thank you all.
Thank you. Bye.